Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials. So, the dengue, malaria and typhoid, these are the three diseases which are more in the seasonal time, like winter or the monsoon transit time, dengue and malaria. But the typhoid is purely, it's a waterborne disease because of the seasonal variations, floods and certain calamities, where the time the safety of the water and the safety of the food is not maintainable, hence the time the infection happens through the food or water, otherwise called it's a waterborne or foodborne diseases. So, the typhoid leads to severe fever, high grade fever from 100 to 106, and then following that you will have a severe pain, headache and body pains. Whereas the dengue and malaria, the typical the surroundings with the mosquito bites, history will be there, and then you will have a fever, where the dengue will have damage to the clotting factor, leads to bleeding disorder, where malaria causes cerebral malaria, which is more neurological disease, which leads to death of the patient. So, these are the three variants. Mosquito bite causes the dengue and malaria, whereas the food and waterborne diseases causes the typhoid. The typhoid, as usually we should manage with an antibacterial tablet drugs, whereas the malaria and dengue can be managed with the symptomatic treatment, where antimalarial drug like chloroquine, and then where dengue, where when there is a decrease in the platelet count because of the damage to the clotting factors, where which can be managed with the supplementation of blood transfusion like SDPs. So, that way this dengue can be managed with the monitoring of the platelet counts and transfusion of the platelets, where malaria can be treated with antimalarial drugs, and then the typhoid can be managed with antibacterial with the paracetamol, and then if necessary admission and management. So, most among these three, little safer is the typhoid is more safer disease. Malaria neglected leads to damage to the brain, coma and death, and whereas dengue leads to bleeding disorder damage, where there is a hemorrhagic dengue leads to death. These are the main points in the dengue, malaria and typhoid, which everyone should know, and taking care of the food, taking care of the hot food and taking care of the water. Otherwise, you can have RO water or mineral water to protect seasonal disease, protect from seasonal disease. Food should be served hot, good food to avoid the typhoid. So, these are the care to be taken in dengue, malaria and typhoid.